inside the trachea and the sternum. So, raise into their shirt. Take another deep breath for me, please. One more. Okay. And then now I would listen to the bronchial vesicular lung sounds, and those are heard a little bit further, but more central at the fourth and fifth intercostal space, just to the left and right of the sternum. Thank you. Everything sounds great. And then the rest of that there would be the vesicular lung sounds. But we already listened to those. Now, one thing we're going to check for, especially in patients with lung issues, is bronchophony. Normally, the patient's voice, you have them say a word or a saying. Some people like to ask the patient to say 99 because of the alliteration. And normally, the patient's voice, as you listen, would become less distinct as you reach the periphery of the lung fields. But when bronchophony is present, positive sign, which is abnormal, the patient's voice remains the same, or actually it can be a little bit louder at the periphery. And this is typically over an area where the patient is experiencing pneumonia. So I'm supposed to do that, if I'm supposed to listen for that, but we'll just go ahead and listen for that.
99.
What?
99.
Yeah.
99. 99. 99. 99.
And it does get less distinct as we move out to the periphery. So now I'm going to start on your abdominal assessment. So if you don't mind, could you lay down with your head here? Alright. So I'd first start by inspecting the patient's abdomen. If you wouldn't mind just pulling your shirt up a little bit for me. And checking the color, if there's any hair distribution, and the contour of the abdomen. Obviously an exam table will be a little higher, but checking to see if there's a flat abdomen, a convex or concave abdomen, and seeing like the weight distribution if anything looks abnormal. But everything looks normal here. One thing we would also check for are any lesions or masses or any visible pulsations of the aortic artery. So now you always start with auscultation on the abdomen. You never touch it hard or palpate it for fear of disrupting bowel sound. So I'm going to start in the right lower quadrant and listen. And then move to the right upper quadrant. And the left upper quadrant. And the left lower quadrant. And there are active bowel sounds in all quadrants. I would listen for about a full minute for all of them, and up to 5 minutes if bowel sounds are hypoactive. But he is active, so we're good there. Another thing that I would do next is listen to the vascular sounds, listening for bruits again, just like we did with the carotid arteries. I'm going to listen to the aortic artery, the iliac artery, and the renal arteries. So I'm going to listen to the aortic, which is straight down the middle. I don't hear any swooshing. And then the renal artery is just below that on either side of the aortic artery. Two upper quadrants. And then the iliac artery is just below the umbilicus to the right and left in the two lower quadrants. Good. And I don't hear any swooshing there. So next, we can palpate because we've done all of our listening. So I'm going to just palpate the abdomen and see if I feel any masses or anything abnormal. And then at this time, I would ask the patient, "Are you having any pain when I palpate?"
No, I'm not.
Awesome. And then if they were, test for rebound tenderness. Maybe the patient's experiencing a problem with their appendix. So you always want to assess for that. Alrighty, so if you want to sit up, you can. I'm finished with that part of the assessment. Next, I'm going to do a peripheral vascular assessment. May I have your hand, please? So I'm going to take a look at his arm, hair distribution. Everything looks normal bilaterally. Nothing's waxy or bare. I'm going to check the nails. Look very kept and clean and cut. There's nothing underneath them, no dirt or grime. And there's no lesions or anything on either arms or either hand. So next, I'm going to check for any edema or peeling skin. Again, everything looks normal on him. On another patient, it might not. Now I'm going to check for your capillary refill, which tests to make sure that your blood is reaching your fingertips. So now you turn your hand over for me. And you want it to be equal or less than 3 seconds, which yours is barely a second, which is great. I'll just check the other hand too. Yep, that's good. Next, I'm going to feel your pulses. There's 3 of them. I'm going to check your radial pulse first, which is on the thumb side. So I'll check that. And that's good. It's strong. I would rate it about a +2. Easy to find and not bounding. Next, I'm going to check the ulnar. If I have your hand again, please, which is directly across from it on the pinky side. And check for that. And that too, the ulnar pulse is a +2, easy to find and not bounding. And then now I'm going to check for the brachial pulse. And that as well is a +2, not bounding and easily able to find. Again, when assessing for the pulses, I would count them for a full minute, or do the shortcut if I feel comfortable doing that. But at this point, we would compare the pulses, probably of the radial pulse and the apical pulse, and see if there is a difference. And sometimes, if there's a difference, that's abnormal, and sometimes that can mean there's something going on. So I'd assess both sides. I'd do the radial over here as well on the thumb side, and make sure that's a +2, which it is, and the ulnar, which it is. And the brachial is the same, so you want to compare both sides and make sure they're the same, which they are. And then now I'm going to check the lower extremities. Even hair, everything looks good, no lesions, cuts, bruises, scrapes. Muscle is there, nothing looks like it's wasting away. Nails as well are clean cut, even hair distribution on each of the toes. In a diabetic patient, I would check the feet in between the toes. So then, In a young man like him, he has no varicose veins, but I would check for those and check for edema as well by pressing in the skin and seeing if there's anything hitting there. I will check the capillary refill while I'm down here on his toes. Make sure that's less than 3 seconds, 3 or less than 3 seconds, which it is on both feet. And then next, I'll check the lower extremity pulses. I'll check behind the knee for the popliteal pulse. On both sides to compare. And both sides are a +2. And then I'm going to come down here to behind the tibia by the ankle and check the posterior tibia pulse. And that one's about a +2 as well. On both sides. So both sides are equal, not bounding, and easily able to find. Then I'm going to come to the top of the foot, just under the big toe and a little bit over, and find the dorsalis pedis pulse on both feet, which you can't see. I'm doing it right now. And they are both as well +2. Not bounding, easily able to find. And one thing I did notice is your feet are a little cold, but it's a little cold in here, and we could get you some socks. So that concludes my assessment. Other than the cold feet, I did not find any abnormal findings today. Do you have any questions for me?
I do not.
Okay. Well, then that concludes my assessment, and thank you.